What causes sudden urinary urgency during a UTI? Imagine feeling like you need to go to the bathroom immediately, even if your bladder isn't very full. That sudden urge is a common symptom of a urinary tract infection, or UTI. When bacteria invade the urinary system, most often the bladder, they cause inflammation that affects how the bladder and surrounding nerves work. This inflammation irritates the lining of the bladder and nearby nerve endings, which are responsible for signaling when the bladder is full and needs to be emptied. Normally, the bladder has stretch receptors that send signals to the brain when it is nearing capacity. During a UTI, these receptors become overly sensitive because of the inflammation. This means even a small amount of urine can trigger a strong, urgent need to urinate. The nerves in the bladder and at the base of the bladder, called the trigone, become irritated and send exaggerated signals to the brain, making you feel the need to go more often and suddenly. The infection can also cause swelling and irritation in areas where the ureters connect to the bladder and the urethra, which are rich in nerve endings. This irritation amplifies the sensation of urgency. Sometimes the bladder muscle may involuntarily contract, which can lead to urge incontinence, where urine leaks out before you can reach the toilet. Other factors can make urinary urgency worse during a UTI. Drinking alcohol or caffeine, which are bladder irritants, can increase symptoms. Dehydration can also make the infection more concentrated and irritating. If someone already has an overactive bladder or interstitial cystitis, a UTI can intensify these symptoms. It is important to recognize that while sudden urgency is common with UTIs, persistent or recurrent symptoms should be checked by a healthcare provider. Sometimes, symptoms like urgency, blood in the urine, or frequent urination can be signs of other conditions, including bladder cancer. Proper diagnosis and treatment are essential to ensure the right care. In summary, the sudden urge to urinate during a UTI happens because bacteria cause inflammation that makes the bladder lining and nerves hypersensitive. This causes the bladder to contract involuntarily and send strong signals to the brain, even when the bladder isn't full. If you experience these symptoms, especially if they persist, it's best to see a healthcare professional for evaluation and appropriate treatment.